a nice discipline that I think I want to encourage young and upcoming doctors to consider when they are making decisions to specialize.
If you had to guess, about how many urologists do you think are in Ghana?
Um, Currently, our numbers may be approaching 50,
50.
50.
For almost 30 million people.
Yes.
That's
and
incredible.
This has come about as a result of the dynamic and very strong current leadership that we have that keeps encouraging young people. For example, Dr. J. Mensah and the likes who encourage the young ones like us to take up this responsibility and to render this important service to our nation.
Well, wow, that's fantastic. I want us, if we have time at the end, to talk more about that because it's important to encourage young people. I know when I was coming up, I had never even heard of a urologist. So I found it very fascinating when, as I got older. Yes, so but let's get down to business because as you know, in Ghana and most countries, not just Ghana, married couples, when they get married, they want to have children. And typically, if there's a situation with infertility, it is usually the woman looked at with like a side eye, oh, she's barren, she's this, she's that. But over the years with science and medical practitioners like yourself, we've come to learn that men too can be infertile. So I have two questions. The first one is, what exactly is infertility and how common is it in men for them to be infertile?
Yeah, thank you for this question. Infertility, by the official definition, one qualifies or one can be diagnosed of infertility in a couple who are sexually active, non-contraceptive, and this condition persists for a year.
Oh.
So this very important element must be met. What do you mean by sexually active? So if a couple is looking for or making attempt to have a child, one of the things we advise them that they must have sexual intercourse at a minimum of 3 times in a week.
Okay.
So if you are not sexually active, means that you haven't met this criteria.
Oh, okay, yes.
And then there should not be contraceptive use.
Uh-huh.
And then if you've met all these criteria and within 1 year of making an attempt to have a child and you are not able to achieve pregnancy, then the couple can be declared as infertile.
Got
So
it.
sometimes we see couples who are trying to have children. The man is in Kumasi and the woman is in Accra.
It's
And
kind
they
of,
meet once in a while. No, we just tell them, you haven't met the criteria.
yes.
Make the necessary arrangement, then you can come back.
Exactly.
Now, in our society, I always wonder personally, why do society always label women as being the cause of infertility? From research, we know that when you're talking about couple being infertile, 50% of the causes of infertility can be attributed to the female alone. Now, about close to 30% can be attributed to the male alone.
Oh, I see.
Now, when you look at the couple, both the male and the female together will have about 20 to 30%. So we say in general terms that the male factor of infertility is about 50%.
Oh.
But I believe because of lack of understanding and appreciation of the causes of infertility, and also due to the fact that when a man and a woman meet, because most men who have produced ejaculation, it is perceived that the man has done his part.
Ah, got it.
And therefore,
yes. Then it must be the woman.
It must be the woman.
Yes.
But actually, I always have this analogy to say that if you are a farmer, you can go and plant seed. But what you are planting is an empty seed. You are only planting the shell. What is inside the seed to cause the fruit to come out? It's not there. So until society appreciates the fact that a man can produce his seminal fluid, but actually there are problems with the seminal fluid, they will keep on blaming women that women are the cause of infertility. Whilst in reality, science tells us that 50% of male factor infertility is responsible for infertility in couples. So it's quite common among male.
Right. Oh my goodness. So It is, and that's very interesting. It's quite common amongst men. So would a man know that he's infertile without coming to see a urologist? How would they know?
Well,
Are there any symptoms?
generally speaking, you cannot see a man walking on the street and say that this man is infertile.
Right.
So, it is only when they are making an attempt to have a child,
Right.
and then they present to us. Then by interrogation, we can pick one or two signs and say that this person is infertile.
Oh, I see.
However, male may have symptoms that may point us clinically to infertility based on the underlying condition that is predisposing
Okay.
the patient to the infertility. So we will go into specific causes, and then we can elicit what is causing a man to be infertile.
I see. So a man could be going through his normal daily activities and have no idea until these factors present themselves.
Exactly so.
Okay. Okay. But how do you go about diagnosing infertility in a man? Is it painful? Is it intrusive?
Well, infertility, like any other medical condition, start with diagnosing infertility, like any medical condition, start with what we call history.
Okay.
First of all, we go into your sexual history. You want to find out how often you engage in sexual activity with your partner. And as I mentioned, if you haven't met the criteria,
Right.
then we'll advise you. And then we'll go into pregnancy history. Of course, we don't expect the man to be pregnant. But we want to find out whether in the past you have made any woman pregnant.
I see.
Because there is what we call primary infertility and secondary
Oh,
infertility.
what is primary infertility?
So primary infertility is a man or woman who is infertile because and he has never had any positive history of ever making a woman pregnant.
I see.
So I will focus more on the man. So if you are a man and you have never made a woman pregnant and we diagnose you of infertility, then the condition is a primary infertility.
I see.
But if you have ever had pregnancy with a woman before, and somewhere along the line you couldn't make a woman pregnant and we diagnose infertility, then your case is secondary infertility.
Got it.
So we'll go into these histories, and then we'll also go into medical history. We know that as men age, they develop certain medical conditions, and these medical conditions can predispose you to having infertility. And then we also want to find out the medication that you are taking, because the medication you are taking can have effect on infertility.
Really?
Yes.
So you could be taking medication, say, for what, like high blood pressure, or like if you hurt your back and you have to, you know, and that could affect?
Medication for back pain may not necessarily affect,
Right.
but there are certain specific medication that doctors may give for one condition. For example, let me give a typical example. You may have a history of being treated for cancer, and you are being given chemotherapeutic agents.
Oh.
So this chemotherapeutic agent has the potential of affecting your fertility.
Oh,
So we want to go into your medical history, and then certain drugs that are used for recreational purpose,
Oh.
non-prescribed
Really?
drugs,
Oh,
can also have a negative consequence on fertility as
Oh,
a male.
Could you give us some examples? Because our men out there are probably thinking, what exactly is he talking about? Those who
Yeah.
like to be fathers one day.
Well, there are people who are abusing steroids for various uses.
Like in the gym,
Yes, in
to
the
bulk
gym.
up.
Yes.
Okay.
Those can lead to infertility and other serious medical condition. And then also we want to find out your childhood history. When you were born, were you having both testes in your scrotum? This is one of the conditions that we always encourage our clinicians that when a baby is delivered, especially a male child, you need to examine the baby at the time of birth to be sure both testes are into the scrotum.
Oh, I see.
If it is not into the scrotum, they will give the baby some time to see whether the testes
come
can
down.
come down. If for some reason that testis is not able to descend into the scrotum, an operation needs to be done to bring that testis down, because it have a
see.
negative consequence on the fertility of such a male child in the future.
Oh,
So we will go into all this history,
I see.
and then examine you, looking out for telltale signs of infertility.
I see.
We examine the penis. Naturally, the external opening where urine is passed, urine comes out through the male, should be at the tip. But in some conditions, some male are born with the opening
Right.
and the undersurface of the penis.
Oh,
So they are not able to deposit semen appropriately. So
Right.
all this examination will be done.
I see.
And then your testes, of course, we have to examine the testes. We want to see the consistency. Normal testes should be just firm. So we want to find out whether it is soft, firm, or hard. And after all this clinical examination, then one of the basic and important investigation we will require you to do is to do semen analysis.
Okay.
And all these things, the history, examination, and all this investigation will lead us to conclude that whether you're having a problem with infertility or not, and then probably establish the cause and tailor your treatment towards it.
Okay, so there is treatment.
There is treatment.
Okay. Well, before we go to that part, I would really like to know if I'm a mother who, say, has recently given birth to a male child, what you said there is very important. I don't think a lot of mothers know that they should make sure that that has been done and then follow up. So I think that's a takeaway that I'd really like to pause to let moms know, and we have a lot of women watching today, that they in some ways, if they start early and are preventative, they can ensure or help ensure that the right things are done when their baby boys are just babies, and so that when they get into manhood, they're not blaming the bride because work wasn't done 25 or 30 years before. So that's a very powerful point, Dr. Foley. I'm so glad you shared that. So I'm very keen to hear so that there is treatment.
Yes.
So kindly share different, and I'm glad you're using layman's terms because even I understand it. So, so what type of treatments are there?
Well, the treatment for infertility actually depends on the cause that we established during your investigation. One of the common causes of infertility is what we call varicocele. Now, what is varicocele? Varicocele are just, in the normal anatomical setting, the scrotum, as you see, has two tubes or cord connecting to it, and there are blood vessels inside. There's a blood vessel that carries blood to the testes, and there's a blood vessel that carries blood away. In some instances, the blood vessel that carries blood away becomes incompetent.
Okay.
So instead of carrying blood away, it becomes dilated.
Okay, what
And
does that
then
mean? Dilated?
It
like
becomes enlarged,
okay.
engorged,
Okay.
with pooling of blood
In the wrong direction?
in the wrong direction.
Got it.
Naturally speaking, God in his wisdom has put the testes outside the human body because the testes function much better at a lower temperature than the normal body temperature.
Okay.
So when there is pooling of blood, it increases the temperature at which the testis is functioning. And therefore the testis does not perform its function optimally.
I see.
So an operation will be done to correct these dilated blood vessels. So if we establish that your infertility is due to this condition, then surgery will be done. That is one.
Okay, wow. That sounds
Well,
very delicate.
Yes. Oh, it's simple, straightforward. That is one of the options for treatment.
Okay.
Now there are some conditions, as I mentioned, the testes have two basic functions. Let me put it that way. There's the function of producing testosterone, which is the male hormone that is responsible for the male sexual characteristic. And then another function is the production of semen or sperm, let me put it that way. Now the sperm production is influenced by hormones, which are special chemicals in the body.
Okay.
An important part of this chemical comes from the brain. Yes.
Really? All the way from up here?
From the brain.
Wow.
Yes. So when investigation is done and we notice that you are producing abnormal hormone, medication will be given to correct this abnormality to help improve your testicular function. That is one of the treatment options. Another of the treatment option is there are some males who are producing normal sperm, but for some reason the sperm is not able to move from where it is produced to be deposited because the channel or the tube through which semen travel is blocked.
Okay.
So if we establish that the cause of this is a blockage, then the blockage can be corrected.
I see.
Yes.
Now, does things like diet or exercise affect any like blockage like that, or?
Well,
It's
diet and exercise will not affect the blockage as it were.
Or could
But-
it cause it?
Not necessarily.
Okay.
But what diet and exercise do is it gives your body the optimal health so that it can function appropriately. Another important way of controlling this condition is weight management. If you have excessive fat, the
Okay.
fat cells produce a certain enzymes called aromatase enzyme. And this reduces the amount of testosterone that you actually need to function optimally. So if you are having infertility issue and we notice that you are super overweight, obese, we advise you to see a dietitian to work on your weight. So there are treatment options.
I see. Oh, well, I'm glad to hear that. And in your experience as a doctor specializing in this field, who normally comes to you? Do men come to you on their own, or is it their wives or girlfriends who, generally speaking, who bring them in kicking and screaming that they don't have a problem?
Generally, men don't come on their own.
I thought so.
Yes. As I mentioned, because it is assumed that the man has done his job, he's planted his seed, is the land on which the seed is being planted that is not good.
I see.
So usually couples who are experiencing infertility will go to the gynecologist.
Oh, I see.
Yes.
So it starts there
That's
first.
there. The gynecologist will investigate the lady, and then as part of the investigation will ask the husband to do preliminary semen analysis. And when the semen analysis comes and it's abnormal, then the couple is referred to see a gynecologist. In fact, most advanced centers that deal with fertility will always recommend that the couple who are experiencing infertility should be investigated from the word go, both the male and the female. You don't start investigating the female before you proceed to investigate the male. So sometimes because some of the treatment options require full participation of the female. So in my practice, when I'm coming to treat this patient, I always insist that bring your wife or your partner for proper conversation so that we can, as a team, plan treatment for this patient.
Okay. Well, thank you very much, Dr. Foley. We're going to take a short commercial break. Our special guest, she's in the house, and she will replace me after this very short break. Have you ever had a minor accident in the house where you may have cut your finger, or your little one playing outside comes running in with a cut, or has bumped his head, or, oh, mommy, I have a headache? Well, MyCare Mobile has the perfect thing for you and your family. That's the MyCare Mobile Deluxe Family First Aid Kit. Deluxe, you say? Yes, Deluxe. This wonderful first aid kit is not only stocked with all of the wonderful items that can take care of small emergencies in the house, from cough syrup to Band-Aids, thermometers, masks, you name it, but it also comes with a contents list which outlines exactly what everything should be used for. Plus, and listen carefully, MyCare Mobile, when you purchase the MyCare Mobile Deluxe First Aid Kit for your family, will also give you one free consultation, good for up to a year after you purchase this beautiful first aid box. And you will be able to consult with a doctor from the comfort of your home or office or on the go. So please reach out to us. Order your first aid mobile care kit before they are all gone. My Care Mobile. Have you ever had a minor accident in the house where you may have cut your finger, or your little one playing outside comes running in with a cut, or has bumped his head, or, oh, mommy, I have a headache? Well, My Care Mobile has the perfect thing for you and your family. That's the My Care Mobile Deluxe Family First Aid Kit. Deluxe, you say? Yes, Deluxe. This wonderful first aid kit is not only stocked with...
Hi everybody, Barbie Nubi here, Shaida Buhari, Shaida Nubi. In fact, I don't even know my name because everybody has a different way of addressing me. So I'm taking over from our Honorable Karen. Thank you for holding down the fort. Dr. Foley, I do not want to waste too much of your time. So I know you've delved into some of the major issues that affect men with fertility. What can we do? What can men do to boost fertility?
Yeah, thank you, buddy. There are a few things that you can do to boost your fertility. One, regular exercise, maintain a good diet, and if you are someone who smokes, smoking, alcohol use have a negative consequence on infertility, negative consequence on fertility. Therefore, we advise couples who are desiring to have children to stop or avoid smoking, to stop or avoid alcohol use. And then there are some few basic recreational or social activities that young people engage in. For example, spending a lot of time in the hot tubs,
Ooh.
saunas. This may look harmless, but in the long term have negative consequence on fertility.
How about athletes?
Athletes, yes. If you're an athlete, fair enough. But if you are using steroids, because there's something called doping, where athletes use drugs to enhance their performance, these steroids have a negative consequence on fertility, especially for male. It has negative consequences. So you have to avoid all this and live a normal, healthy lifestyle.
So is there like, because in the past, I'm not sure, but I saw a documentary about a biker who developed some kind of scrotum cancer, and it eventually affected his fertility. I'm not sure, I can't remember, but he was a renowned, I'm not sure if it was, what's the name, is it Armstrong?
Well, I'm not sure. I don't want to go into specifics.
Yes.
But what I want to say, if you have a cancer of the testis, the scrotum is just the covering of the testis. If you have cancer of the testis, then your fertility may be compromised. So what we usually advise a patient who have cancer of the testis is, once, you may need surgery to remove that testis with cancer. Two, we may give you chemotherapy, which may have a negative consequence on the other testis, which is not non-cancerous. So in this patient, we advise them to do what we call sperm banking.
Okay.
So you go and donate your sperm,
all right,
and this will be banked so that any treatment that is done, even when it has effect on your fertility, you have sperm that are banked that you can fall on to deal with your fertility issues.
Okay. So, I mean, we live in a society where we do not have a lot of this information. Even with those who have this information, I mean, it's difficult for us to basically find the resources that we need to be able to do what you are recommending. So for the person who does not know about, I mean, basically going to the sperm bank and conserving their sperm, what can you tell them? And what is the cost involved in this procedure?
Well, I would like to inform the public that these treatment options are available.
Okay.
If you speak to your urologist, he will be able to give you the appropriate advice and direct you to the facilities that do this. Unfortunately, I wouldn't want to mention the names
I
of
totally understand.
other facilities. We'll be doing free advertisements for them.
I
So
totally
the treatment
get it. Yeah.
is available.
Okay.
But I would like to add that these treatments are not covered by insurance.
Okay.
Yes, but they are available.
What is the cost range? Is it something that everybody can afford?
I don't have the figure off my head,
Oh,
but I think if you really need to protect your future progeny, I'm sure you'll find the resources to do the sperm banking.
Now, let's retract just a little bit. There are statements that riding a bicycle for so long can affect your fertility. Sitting down for a pretty long time can affect you. Playing football, I mean, you know the way men play, obviously, yes. I mean, I have brothers, so I grew up amongst my brothers, and my siblings were very rough when it comes to play, and they literally attack specific areas of their bodies, and to them it's fun. And those who went to boys' schools, I mean, you have instances where the men, their colleagues just grab on their privates, and they think it's a joke. They think it's funny for them to do that. How does these particular actions affect male fertility?
Okay. It all feeds down to or boils down to one important statement. As I mentioned earlier, generally speaking, the testis or the testis is outside the human body. The normal human body operates at a temperature of 37 degrees. The testis function better at a relatively lower temperature of 34, 35 degrees Celsius. So when you are biking, you are applying pressure to the testis. So once you are sitting for a long time, you generate heat. And testis is one important organ that does not tolerate heat.
You need to leave it to breathe.
To breathe.
Okay.
That is why even couples who are having fertility issue and we diagnose male infertility, we always advise the man to use cotton underwear, because cotton underwear generates less heat.
Okay.
Now, if you spend a lot of time in sauna, you spend a lot of time in the hot tub, all these activities generate heat. For example, you are a corporate person, you've been working for long hours, you put the laptop on your lap for hours, the laptop is generating heat, and this heat goes a long way to affect the testis. When it affects the testis doesn't work optimally. Its function of sperm production is compromised. So any activity that generates unnecessary heat to the testis will affect your fertility. What I'm not sure of is playing ball.
Okay.
Yes.
Okay.
Yes.
Okay. And kicking that private area,
Well, kicking.
applying any form of pressure.
Yes. Not only that one, when you kick the private area, you are causing trauma to the testis. There are cells there.
Yeah.
So the trauma, the healing process, all this can affect the testis in the long run. So any trauma to the testis or infection to the testis put you at risk of infertility.
You know, I raised this particular issue because I have a very close friend of mine, and he mentioned that in school, in boarding school, one of his seniors actually kicked him in the private area, and till today, when he wants to like have intercourse, he has to lie on his side because his private area is like bent to the corner. But I don't know if he's going to have fertility issues. I don't know how that is going to affect him when it comes to him procreating. but I just thought maybe it's a contributing factor, and that is why I kept on like
Okay,
hitting
I
on that
think I
particular.
have a better understanding of you.
Yes.
So what you are saying is that the penile shaft or the
Mhm.
phallus
Mhm.
is bent
To
onto
the
one side.
Yes.
So there's a condition called peroneus disease,
Okay.
which affects the shaft.
Okay.
So instead of the shaft being straight,
Mhm.
it can bend. Now, where the infertility arises, if it bends to a degree where it's not able to deposit semen, then you will have problem with infertility.
Wow.
Yes. So
Wow,
it
wow,
depends
wow.
on the degree of the bend.
Wow.
Yes. If the degree is so severe that it's not able to deposit semen, then you have an issue with fertility.
So it's safe to say no rough play in that sacred area.
It doesn't make, or it's not funny to be playing with your genitalia.
Well, that's true,
Yes,
but I mean,
so
boys have a way of thinking everything is funny. So I hope they would heed to this advice and be more careful, more cautious with that area. Okay, so what are some of the common factors that basically affect this? I mean, people who are, I don't know if, how do people who are probably affected by infertility step forward or ask for help?
well, infertility may affect the man ego. That's one aspect. And then their studies have shown that for men who have problem with infertility, their self-confidence and their sexual satisfaction is lower compared to men who do not have fertility issue. So I want to encourage men that treatment is available. So they should seek help early, especially when they are aging or when they have associated medical condition. Help is available. They shouldn't feel shy about it. They should assume or take it as one of the medical conditions that human beings develop and seek prompt treatment.
Now, Dr. Foley, I know that you've seen a few patients with this condition. Do they come, do they volunteer themselves or they are dragged in by their spouses?
Usually the spouses will encourage them to come. Yes.
Why do you think this is an issue? Because, I mean, I run a platform that is predominantly for female. And, I mean, obviously there's this perception about infertility when it comes to infertility in women. Is usually an issue. The man is not usually even considered under such circumstances. The first person they say to go get help is the woman. So what kind of education do you think we need? What kind of approaches do you think we need to be able to curb this stereotype?
Well, it all boils down to lack of information. And as we are addressing, I believe we are giving out information to the public. And as I mentioned, what we call male factor of infertility is about 50%, which means men are equally responsible for infertility. And as I mentioned, I think society, especially in a patriarchal society as we are, we assume that because the man has deposited seminal fluid, he's done his job, and therefore it is the responsibility of the woman to keep and produce what the man has deposited. But in fact, what the man may be depositing is just seminal fluid without a single sperm.
That's true.
So until we come to understanding that infertility can be caused by a male or by female, we'll be putting undue pressure on the female.
Yeah, that's true.
So lack of appropriate information or lack of education is mostly responsible for this undue pressure that we put on our women.
But how accepting are the men when it comes to this situation?
Usually when a man comes to the clinic, you examine him, you've done all the semen analysis, and then clearly there's an unambiguous evidence that his semen parameters are not normal. It's quite a relatively big blow to their ego. So you need counseling encourage them, and then to tell them that all hope is not lost. And then bring the couple, the wife along, and then you fashion appropriate treatment based on that particular patient's diagnosis.
This is very interesting. I mean, I'm wondering what your experience has been with such incidents.
Well, one of the interesting things you find is when you finally establish that the infertility is due to or the fault is coming from the male, or the male factor is mostly responsible, then the man becomes more attentive towards the woman, because he feels psychologically that now that the woman knows that I'm the cause, if I don't pay proper attention to the lady, then there may be marital disharmony. Then counseling, I think the main part of the treatment is counseling. So once you talk to them and explain the options, I believe they can overcome. One of the treatment options that have not been used widely, which we want to encourage our male patients who are infertility to consider, what we call donor sperm. There are some men that, after thorough investigation, realize that this man, there is no way he can fertilize. There's no way he can make a woman pregnant because he doesn't have sperm at all. For example, he has what we call primary testicular failure.
Wow.
So one of the ways you can have a child is donor sperm. And these treatment options are available in the country. So we should encourage our male to open up and seek help.
Can I ask you a very sensitive question?
Or you can ask, if I can answer, why not?
How, I mean, as a man, touch wood, you found yourself, in such a situation, would you opt for this option? How easy would it be for you to do that?
I must admit, I'm not in this situation. It's a hypothetical situation. I have two lovely kids.
Oh, wonderful,
yes,
wonderful.
But I believe it has to do with counseling. It has to do with counseling. Because in this case, one person may be fertile, but there's unambiguous evidence that you cannot produce any sperm. So what do? You must counsel the couple. That's why I said that in investigating couple for infertility, it is important to start investigating the two from the word go.
That's true.
Yes.
That's
so
true.
by counseling, you may be able to overcome that. And what has been, I don't think it's going to be an easy.
Yeah.
Yes.
Especially with our culture, we've had instances where men do not care. They basically would rather have their brother, their friend, their security, any male figure around them have intercourse with their wives so that they can pretend that they are the father instead of going in for donor sperms. And we've had several situations where paternity tests have, basically come back false. A lot of issues with some of the famous, some famous individuals in society, they go in for the paternity test. In fact, if I should come up with some kind of statistic, I would say that 60% of the people who think they fathered certain children probably didn't or aren't their biological fathers. And it's a long stretch. But we've had instances, especially on my platform, where mothers will come and say, okay, this child is not for my husband, or the father has confessed that I don't think these kids are mine. A similar situation happened in my neighborhood where this gentleman was taking care of his child lovingly, and all that for like 7 years, only for him to find out that, Charlie, this child wasn't mine. We've had several examples of such occurrences happening in our society. Is it the fertility aspect of it, or our inability to accept the fact that these things are real and we can address it differently? I don't know if you're getting my drift.
Yeah.
It's a bit loaded.
Yes, a bit loaded.
Yes. Very loaded.
Yes. Well, as I'm glad you, at some point in your question you say it's far-fetched. We don't have the evidence
Yeah, we don't.
as we sit now,
But Charlie is
as we
will.
sit here, to say that majority.
Well,
But yes, such occurrences do happen. And I also think it's because we haven't utilized the option of donor sperm. So what is happening in this case is that the woman is going for donor sperm in quotes
that's true.
from a different
From a
male
different source.
without the
yeah.
consent
That's true.
of the
That's
husband.
True. That's
Yes,
true.
which is not fair
Yeah.
to the husband. Probably because she's now gotten the information that the husband is not able to make her pregnant. So she's looking for a solution on her own.
You know, it's funny.
Yes.
Sorry, not to catch you.
Okay.
It's because of the pressure that society puts on them. That is why some women basically choose that route. That's probably the only reason why a woman would force herself to probably have intercourse with someone that isn't her husband.
Well, that is true. But the risk to that is that you are exposing yourself to unnecessary sexually transmitted infection,
That's
which
true.
could be disastrous to the
That's
relationship.
true. Yeah.
So we want to say that donor sperm is available. So before you go for donor sperm, whoever is coming to donate a sperm, the person is detailed medical history will be taken. You'll be screened for all these sexually transmitted infections, which is safe. Sometimes they go into your family history. Do you have abnormal genetic diseases in your family? If you have all these things, then whoever is going for that sperm will ask, okay, this person who has donated, does he have any mental illness? What is his level of education? What is his height? What is his, is he obese? Is he slim? Is
Yeah.
it, based on what you want, then you can go for this. So I think if we open our society by letting know that donor sperm is one of the available treatment options, why not?
I mean,
It is way, way safer than trying to solve your own problem
solve your
on
own
the side
problem.
issue.
You know, sometimes
Yes.
we like to play.
So that
God.
one-
Yeah,
For future DNA will expose you.
that's true.
But when you do donor
That is
insemination,
happening a lot.
the couples are on the same
yes,
page,
that's
and they will not
true.
be surprised by DNA tests in the future.
You're
So I really
right.
want to encourage
You're
the men
right.
to look at this option.
So, aside from the basic genetics, cancer, heat and all that, what are some of the other causes of infertility in men?
Yes. If you have, as I mentioned, these are controlled by chemicals from the body called hormones. If you have tumor in some part of the brain called pituitary,
Okay.
they secrete chemicals or hormones that affect the testes. If you have tumor there, you will not be able to produce the right amount of sperm.
Okay.
That will be
Okay.
dealt with. Then, as men, they also develop other conditions. Diabetes and other conditions may have a negative effect on the semen in terms of the amount that you can prepare forward. There's a condition we call retrograde ejaculation. So a man ejaculates, instead of the seminal fluid moving forward, it goes back into the bladder.
Wow.
So all these things can be cause of infertility. So I also want to stress on the use of steroids, because a lot of young people want to have muscles.
Yes. Yeah.
And they do or do abuse a lot of anabolic steroids
Okay.
to give them big
Muscles. Yeah.
tall, strong.
Mm-hmm.
And it's a paradox. It's a certain paradox. We call it Mossman-Passive paradox. So you see a man who looks tall, strong, built, you think that this is a man. But actually this man doesn't have any semen at all
Whoa.
because of this steroid. And this steroid have a negative consequence on their kidney. It can lead to kidney function problem. You can have problems on the heart. Your heart will be enlarged. It can cause you to have baldness. Yes. And then it makes your testes small. So we want to encourage our brothers who want to be more athletic. They should do it a natural way instead of engaging in illicit use of these steroids.
So for some it's like a lifestyle.
Yes.
It's interesting to hear this. I'm actually taken aback. Um, we as women, what can we do to help some of the men who are dealing with the situation? How can we educate them without bruising their egos?
That's very important. As I mentioned, that's where fertility treatment, for you to be successful, you need a couple to be on the same page. So it is
Yeah.
important that you keep on showing your love and your affection to the man, because at the point where the man is diagnosed of having male factor infertility, that may bruise his ego. So you need to encourage him. And one of the recommendation that we give to couples, those who are having infertility, is there are certain times during the during the female normal menstrual cycle that the woman ovulate, and it is during the ovulation period that the woman can become fertile.
Yeah.
And because one of the things we recommend is to try and engage in sexual activity during that period. And for couples who are having fertility issues or infertility for that matter, they need to be motivated to engage themselves around this period. This is the point where the woman must actively encourage the husband. So the support of the lady is very
spouse,
important
yeah.
in achieving a good success when it comes to treatment of this condition.
So, Doc, is there a cure for infertility in men? Is there hope?
Oh yes, there's hope. There is hope. So if you identify the cause, you treat it. One of the things that I haven't mentioned is the concept of surrogacy. Couples can consider surrogacy, donors, sperm, and there are a lot of assisted reproductive techniques. For example, a man may have a certain amount of sperm, which may not be the normal amount required to make the wife pregnant naturally. That small amount of sperm that you have can be harvested and used for assisted reproduction.
That's interesting. But with what about taking in medication? Just
Yes.
medications that
Yes.
would improve
Good.
the male fertility, because I know
Good.
women have medications that boost their hormones,
Yes.
improving fertility.
Yes.
Basic.
Yes, we do have medication. Depending on the amount of sperm that the man has, we make medication to boost the amount.
Okay.
And then there are hormonal replacements that we sometimes give to help boost semen production.
Okay. Okay.
And sometimes the cause have to be surgically corrected.
Wow.
Yes. So all those treatment options are also
available.
there. Yes.
But a lot of people don't know that as a man, there's some medication that you can ingest to make you feel better, or there's some operation that could help you perform better. I want to give you the opportunity to basically put our men at ease with this information. I want you to reiterate it and let them know that it's not like a death sentence. Is not to disgrace or shame anyone. It's a normal condition that could be fixed. And the possibility of changing the current situation is very high. What can you say to encourage the man out there watching you today thinking, no, there's no hope for me? I'm not even going to go in to ask for help.
Well, to make it simple and snappy, I want to encourage men that there are treatment options. Some of the problems or the cause of infertility can be corrected by just simple medication. Some can be corrected by just counseling. Yes, and then some, as I mentioned, can be corrected by assisted reproductive techniques. Don't forget donor sperm is an option.
Yes. Yeah.
Surrogacy can help couples.
Yes. Yes.
Then, the last but not the least, adoption
Adoption.
is one of the important
Adoption.
options that we haven't used much.
Yes. That's true.
because of the society that we live.
Yes.
These options are available,
That's true.
and they are
That's
treatments that can bring joy to the home.
That's absolutely true. And I also like to tell our members that, hey, we are all born and we are all expected to live very unique lifestyles. Not everybody has or will conceive and give birth to a child. If it happens, fine. I mean, it's something to celebrate. But if it doesn't happen, don't beat yourself up. And don't go kidnapping or doing things that are illegal just to have a child. Just embrace it, look at other options and move on from there. I want us to delve a little bit into lifestyle. What are some of the lifestyle changes, some of the things that a man could do to improve fertility?
Well, the lifestyle changes basically have to do with socially acquired habits.
Mm-hmm.
If you someone who enjoys smoking, will want to advise you to stop because it has a negative consequence on your sperm production and your fertility. Alcohol can have a negative consequence on your fertility.
That's true.
So if you cannot stop it, try and cut it down significantly. If you smoke marijuana, you abuse steroids, for whatever reason, all these things have a negative consequence.
Marijuana affects fertility?
Yes.
Wow. It's
Any
interesting.
form of smoking you do have a negative
Wow.
consequence on your fertility. So if you do modify these lifestyles, you should have a better quality of life in terms of fertility.
I mean, I have a list of questions here, but I think we're probably running out of time. I'm still going to ask a few things as per male fertility. What is the typical man who is bold in his own skin and in his own condition? What does he do when he finds out this situation? Like, does he find out in the presence of his wife, or he likes to be privately counseled? What is the ideal environment to basically educate someone about this situation? Because we did an ad on one of my platforms, which is a mixed platform, and we called on men who were willing to seek help, also talk about their current situation. One gentleman literally stepped up and basically volunteered to be a resource person, but eventually he shied away, and I really want to apologize to our viewers because everybody was expecting him to be here today, but unfortunately he just decided not to participate. And I noticed this being a very sensitive issue for a lot of people on the platform, to the point where they were angry that I had taken on this particular issue. It seemed as though they felt I was trying to disgrace them or shame them, which isn't necessarily my intent. It will never be my intention. So how, as a woman, to a doctor, a father, a husband, a man, how can we women let men understand that it's not an issue of attack or shaming or disgracing? How can we do that? Is it better for it to come from a fellow man, or is it okay for it to come from literally anyone?
Well, thank you, Babi. Basically, I think it has to do with the construct of our society. We don't confidently and openly talk about sexual and reproductive health. So I think most men and women grow up shying from discussing this all but important issue. So, and as I mentioned, it becomes a matter of ego. You are a man and say you can make a woman pregnant. So you feel you are not really a man in quotes. So it lowers their self-esteem and their confidence. So you need to provide a private environment, provide confidentiality, reassurance, counseling. And I believe with time, repeated counseling, we should be able to overcome some of these challenges. Um, it is not a problem of man or problem of a woman. It's a problem of the couple. If they have that mind together. I've seen in my practice quite a number of men who have been referred to me who have infertility. You see that women were supportive because I always insist that bring your wife. When they come, you talk to them together and you explain it. Even when they need procedure to be done, you see that the women are very, very supportive. So it depends on the way we communicate, reassure them.
That's true.
And it boosts their self-confidence.
I personally feel like the issue isn't anyone, a woman, a gender per se, is the way somebody feels about their own self and the way they think society expects them to perhaps perform. Is a thing of pride for a man to be known as very well performing or high performing when it comes to, producing babies. And so, like you said, yes, it's a societal thing. And I think, as I don't know how old your kids are, but we need to also start at a very young age. I don't know what you think about that. Education for younger ones.
Yes.
What are your thoughts on that?
Yes, it's important to educate them, but the education must be tailored and appropriate for age.
Absolutely.
Yes. So
Absolutely.
at a young age, we need to tell them what they should expect as they grow. At school, who should not touch certain part of your body.
Of your body.
Yes,
Yeah.
and we should be open to discuss this with our kids as they grow along.
Growing up, this kind of topic was an abomination. Nobody was allowed to talk about this, but it's something that concerns us as individuals, as parents, as couples and spouses and all that. It's a very important aspect of our society, and I think it's something that we really need to start taking seriously. One other issue: men don't like going to the hospital. My husband, you have to literally beg him to take him to the hospital. And I don't know why. Is it like that with most men? Is this a situation with most men? Because I know a lot of men, they will be sick. My husband will be sick. He'll be rolling. You literally have to drag him to go to the hospital. So I don't know how people manage to get their husbands or spouses to actually come in for the help that they might require. Well, is it also like a societal thing?
Yeah, I think so. Maybe societal. I think when it comes to infertility, it's like, so one of the things that we must, as those who work in the hospital, is to provide the appropriate environment. So when I'm coming to see a patient or a couple with infertility, I always insist that no one else should be there apart from the chaperone, which is my nurse. And then you provide the appropriate environment so that they can communicate freely.
That's true.
Where they feel that when they come to the hospital, their problem is going to remain known to the world, then they are hesitant.
That's true.
So we must, those of us who work in hospitals, must also provide the appropriate environment where couples can feel confident, open up and discuss their issues so that we can give the appropriate help.
That's true. And I also think that men who, like you, men who have also overcome or treated this condition should be bold enough to come out and talk about it. It would really make an impact if someone knows that another person has dealt with or is dealing with or is basically going through what they are probably also dealing with at a particular time. Sharing is basically helping someone and making an impact in society. So anyway, Dr. Foley, let me not take the stage. Give us your closing remarks so we can wrap this up?
Well, before my closing remarks, you mentioned an important point that I want to re-emphasize. Let me give an example. Those who have breast cancer and have survived, they have breast cancer survivor groups.
Yes.
So anybody who is diagnosed with breast cancer can go there. You will meet people of like mind. They'll counsel you and give you hope. So if people like Barbie and the rest you want to form fertility associated groups, those of us who are in the technical side will be more than willing to give you a support.
Yay.
So if you have a support group
for men
who will go there, not only men, but let's make it couple-centered.
Couple-centered, okay.
Yeah, so that couples who have fertility issues can come and get some of this support. It will help.
It will be an honor to create such a platform.
Yes.
We'll definitely look into that. That's a really good idea.
Yeah. I also want to say that fertility is not a hopeless situation. There are treatment options available. And men should be open and be encouraged to seek an early treatment for this condition and to bring joy to the home.
Thank you so much. You are a breath of fresh air, and this has been extremely insightful. Thank you for sharing your perspective, your experience, your expertise, and sharing some kind of hope to those who probably had no idea that this was something that we all needed help with. So thank you, Dr. Foley.
Thank you for having me.
It's always my pleasure. And thank you to Rabito and My Care Mobile. We really do appreciate the opportunity to be here today. We look forward to having more insightful conversations. And I hope if you have any questions whatsoever, and you also want to join the support group that Dr. Foley recommended, do not hesitate to call me or contact any of the resource persons online. Thank you so much, and do have a lovely evening. And wait, it's Black Friday. I hope you're going out to have fun. Happy Black Friday. Bye-bye. Remember, your safety protocols is highly imperative. We need you alive, we need you safe, we need you happy. All the best. Bye.
Have you ever had a minor accident in the house where you may have cut your finger, or your little one playing outside comes running in with a cut, or has bumped his head, or, oh, mommy, I have a headache? Well, My Care Mobile has the perfect thing for you and your family. That's the My Care Mobile Deluxe Family First Aid Kit. Deluxe, you say? Yes, Deluxe. This wonderful first aid kit is not only stocked with all of the wonderful items that can take care of small emergencies in the house, from cough syrup to Band-Aids, thermometers, masks, you name it, but it also comes with a contents list which outlines exactly what everything should be used for. Plus, and listen carefully, My Care Mobile, when you purchase the My Care Mobile Deluxe First Aid Kit for your family, will also give you one free consultation, good for up to a year after you purchase this beautiful first aid box. And you will be able to consult with a doctor from the comfort of your home or office or on the go. So please reach out to us. Order your first aid mobile care kit before they are all gone. My Care Mobile.